Good evening, everyone present here. I am Faraz from IGCP Group. Welcome all the participants on today's live discussion on a very important topic. Let me tell you the topic for today's live. This is hairline design, art, anatomy, and ethics. As we know that hairline is a very common problem these days, but having a proper knowledge is very much important. So this topic is important. So we need someone who is expert. So without any further delay, I would like to invite our guest for this webinar, none other than Dr. Avinash Agarwal, sir. And let me share some of the achievement of sir. Sir has done MS in General Surgery, Director and Health Consultant at Acube Aesthetic Clinic, Mumbai, and exclusive hair transplant surgeon since 2009. So without any further delay, I would like to hand over this webinar to sir. Sir, you can move ahead. Over to you, sir.
Yeah, so thank you so much once again for this beautiful opportunity to talk on hair, which is my favorite and my most beloved subject. I keep talking about it all the time and telling all my people that yes, is something that you can have on your scalp is your hair, and nothing but your beauty can be defined only by your hair. So there is a hairline that you see after your eyebrow, and after which nobody wants to walk away through, and that's where the significance of hairline lies. So when you see a person, you actually see into their eye, you see into their eyebrows, and there's a particular level after which you stop. You do not want to glance through his whole bald scalp, and hence you want to stop at a particular level, and that level is your hairline. So talking today about your hairline designing. Yes, androgenetic alopecia is the condition in which typically men and women both lose their hairline. Of course, in women, typically you see a balding patch right in the top of the scalp, and that extends into the whole area of the scalp. But in men, what typically starts as grade 2 thinning also is the hairline reduction. The hairline starts to recede up to a centimeter. The temple starts to peak in. This is called temporal recession, which is a very common feature in most of the men that can happen because they recede in the temples, and hence you need to shorten it or make the temple peak in such a way that the person looks his age appropriate. It can suit his profession, it can suit his personality, and it can really make him look as though he's at least 10 to 15 years younger than his age. And that's what significant importance where comes in is a hair transplant surgeon. Choose your surgeon who knows his hairline design art right. Yes. Talking of more about hairline thinning, this typically happens with grade 1 and grade 2 patients who come in and ask only the hairline filling. These could be patients who are from the media fraternity or model or somebody who really need to focus on their hairline majorly. But of course, we would always want to wait to do a hair transplant in a patient beyond grade 3 and 4. Grade 2 is only when you really necessarily have to do it depending on what profession the patient lies in. So you can see these are the pictures of patients who have already gone as thinning in the frontal hairline. There is a V pattern, there is an M pattern, and there's all these different patterns that you can see. And in grade 3 and above, where there is a thinning on the top area of the scalp and the crown, which is starting to show, you need to do more aggressive management with medical treatment. There is something to do with low light laser therapy, mesotherapy, PRP injections, growth factor injections, now in exosomes, which can actually send in the right messages to make the follicles usher back, come back to its natural life. And hence you can actually grow back the hair at the top and the crown. But in my experience with so many years, you haven't seen much a growth in the hairline, which typically can only come after you do a hairline transplant. And that's what shows you the most looking, natural looking hairline that only a hair transplant surgeon can give you. So stage 3 and 4 above, you definitely have to do a hairline transplant. What number of grafts you're going to talk in the slides here coming forward? So where do we see the naturalness of the hairline? If you divide the face into two parts, the face is not a mirror image of the other side. So remember, your hairline should not be exactly the mirror of the other side. Hence, you need to have the macro and the micro irregularities in your hairline, which definitely can create more naturalness in the hairline with single hairline grafts. Talking of the crookedness of the hairline, as we just said, it has to be irregularly irregular. Now, these words that I'm really using is, of course, from the books, and these micro and macro irregularities, which can come in, as I call it, stars and moons. You can create those kind of star pattern. You can create those kind of moon pattern in which the hairline becomes softer by only single hairline grafts that can be placed in the frontal part so that the naturalness of the hairline can be maintained. Of course, some men sometimes like to have a widow's peak, and women definitely with a lot of widow's peak can really make their hairline look more youthful and their face more heart shaped and hence more youthful and more presentable. Of course, in the plastic surgical terms, we always call a heart shaped face as the best face. Talking of the angles in which the hair should grow, this is how the angles are shown. You can always see the frontal area, the hair starts to grow forward and then it starts bending downwards and then more outwards and inwards. Now remember, this is the angles in which the hair grow. The acuteness in which the hair is planted always is as you see at the back. You mimic the same in the front, but at the same time, while coming in the front, the acuteness starts to make stronger. So if it's a 20-degree angulation, you start making it 15, and you slowly start making it to 12 and 10 degrees also. And that closeness in which the hair has to be planted with the right depth and the direction has maintained, the follicles will survive and stay fantastic. Now I'm going to talk more about how uh, the density can be improved in the temple peaks that is looking more natural. Remember, people sometimes tend to put a lot of grass with twos and threes, or they put a crowded number of grass which look too fuller in the temple region, which is just not needed. Talking of the naturalness, why do we need a natural hairline? Because the face has a shape, and that shape really is enhanced by having a heart-shaped face will have a widow's peak typically, an oval face will typically have a V receding pattern, a squarish face will have a U receding pattern, an oblong face will have a U thin, sharp hairline, shaped hairline, and the broad forehead, typically which has a very broad forehead or a bigger head, we call it. These people have more a deeper V or a deeper U-shaped hairline. Now, how do you correct these hairlines? Of course, you can always bring them, make it softer. See their old pictures of 10 years, 15 years back, how they looked, and probably try to mimic certain part of it, but never give a hairline of a youth. So, a person who's in their 50s and 60s, or a person who's very youthful also, do not want to give them a hairline of a 20-year-old back, because remember, they are going to advance their age, and hence you want a hairline of a middle aged person. I'm going to talk of the nuances in the next few slides. Of course, temple piece can be more sharp or blunt curve depending on the jaw shape. So remember, when you have a jaw, which is a very strong jaw, the person should have a very sharp angle to their temple peaks. The person has a very blunt jaw or a fuller cheek. They typically can have a very rounded, curved temple peaks, and that also will look nice. Now, looking at the eyebrows, now how do you really decide where the hairline should start? You ask the patient to raise their brows. And when they raise their brows, there's a frontalis muscle, and the muscle ends at a particular point, and after 1 centimeter beyond that is what you should mark your first point, the central middle point. And as you go at the backwards, there is a progressive increase in the sides where the temple peaks have to be raised. Now, remember, when the temples are going more backwards, you cannot take it as back as it is usually. So you have to bring them little forward depending on what you see as the sideburn. So you take the sideburn and draw a perpendicular angle straight up to the sky. So you make the patient sit straight, and you take an angle which is from the sideburn, the outer edge of the sideburn, a perpendicular angle going straight to the sky. And there's a line that will match between your line that you draw as you keep on progressively increasing the recession, and you draw a straight line. There will be a point that you will come to, and that point has to be either a sharp point or a curved point depending on the jaw structure that you see. Now, of course, the rule of three is the three, three, and three. So if you see that same distances between the face, so from nose there is a point that goes all up to the gabla, and from the gabla to the point which is what the forehead line. This three area has to be matching, almost similar. But of course, you can increase the forehead size depending on what the person's face is. Typically, if he has a very oblong face or he always had a broad forehead, you can maintain that broadness of the forehead. And the key feature here is the irregularity that you create in your natural hairline. Now, as I talk about the apex angle, the interior border angles, and the lateral epicanthal line, which is typically the line at the edge. So this typically line that you see at the edge is very important. This has to be maintained. If you see the distance between the eyebrow and the epicanthal line, or the lateral hub, that point has to be almost 1/3 and 2/3. So that distance, if you maintain, you will never go wrong. So that 1/3 and 2/3 distance, if you will maintain it, you will definitely make the extent of the angles or the lateral hub much superior. Talking of how, as I said, the 1/3 ratio is very important, the rule of three. So if you divide the face into three parts, this is where you look at it. And this is the most important line where you actually draw the whole face should look like. Very good for plastic surgeons to define and make out where exactly they want to have more of their face filling or fillers, or maybe some kind of a fat graft or a jawline, which can be made with a implant and things like that. Of course, now talking of the zones that I'm talking here is there is a thin zone, which is, of course, you can see the X here, and there is something called as the dense zone. And the dense zone, these typical areas have grafts which are either created in the coronal planes or the sagittal planes. Now, looking at the density that one wants to create, I've always preferred the sagittal plane. Sagittal plane is the one which goes through the person. So that is called a sagittal plane. If you see these pictures here, this is typically a sagittal plane slits which are created, which is absolutely standing straight. But if you go more flatter to the face, these are called coronal slits. And these coronal slits will give you grafts, but the graft, if they are curved or if they are not very easy to plant, you can probably think of those kind of slits, but you will have lesser density. So you will have to come back and do more density in the near future, which could be an extended session sometimes for some patients. And remember, there is area which they have shown already here. If you see this area, here the density is typically up to 35 to 55 grams per square centimeter. As you keep seeing the frontal zone, which is about 4 to 5 millimeters, here 2 to 3 rows of single hair and double hair in the end has to be mixed with about 15 to 20 grams per square centimeter, not more than that. And if you come to the lateral hub, there's something which is more receding at the sides. This area also, the graft quantity should not be more than 20 to 25 grafts. As we keep going on the top, you can always have 35 to 40 hair. And of course, the forelock is the most thickest area that you plant. Now, looking at female hairline and hair loss, of course, you can reduce the hairline to a certain extent. But remember, you would probably want a hairline to be looking more softer in a woman. First is the recession that can be just brought down and maintain the same pattern, or you can just give them a more circular face as they prefer. But remember, all this is done by the old picture that you see of the patient, and then you make a informed decision. This is a few picture of patients who've done hairline transplant, typically in the front and the top area. This is just up to 3,300 grafts which were planted. Of course, the quality of the grafts were very good. The hairline was much softer. And of course, as we keep going back down, we have twos and threes as grafts, which definitely hold a good density. This is somebody who's an actor, brings his hairline down. Of course, his broader forehead and typically more further away hairline made him look more aged. And of course, his roles that he was presenting was very, very senior, and he wanted to look like a boy. And of course, we gave him a little boyish looking hairline, but a hairline that can survive with him even after the age of 70 to 80 years old. Something that you can see in the hairline typically for patients who are very youthful, up to 24 years of age, 30 years of age, they would want a hairline which is receding, plus at the same time, something more fuller in their frontal forelock. So you can see the forelock is filled well, and hence his whole appearance after having to keep his hair a little longer looks more natural to him. This is, of course, a dear friend who gets his hairline done. And again, you can see the temple peak, the lateral hub, the hairline, and all is in a receding fashion. You can absolutely match to the sides, and those are not a mirror image of each other. If you see the right and the left, there's definitely two different vast difference. With just about 2,500 grafts, we could achieve a very soft, natural-looking hairline, totally undetectable by if you have done a heart transplant or no. Again, somebody who comes with a temple peak, a lateral hub, all these needs to be filled in. You always calculate the right distance for the patient. And as I said, draw a line from the outside of your sideburn, perpendicular going upwards. And that point, meeting a receding point that you draw as a hairline, will definitely have you covered if you're doing a temple peak designing or receding or bringing in the temple peaks also. This is again a young boy, 19, gets a transplant done filled only in the hairline. This is just grade 2 of surgery, a grade 2 of hair loss, Northwest classification. Of course, he needs that because, of course, into modeling industry, he needs to have a hairline which is more youthful. And we did recede it, but of course, with not too much of fullness, we gave a very faint looking hairline with about just 1900 grafts and covered the whole zone. This is again a hairline design which is bottom. You can fairly see a nice widow's peak which is created for this gentleman. He had an oblong face, a very pointed chin, and hence that peak really enhanced his appearance. To the left you can see him, of course, but to the right he's done a density session, repeated a second session of about 1200 grafts in the hairline again, with most of singles that is given him more softness and naturalness to his hairline, but with good density. Now, something which looks after post-operative 1800 to 2000 grafts, even with temples filled in. And this is after the hairline results have come in. You can see how the temple peak is typically designed, which is very beautiful. This is where the point is. From here, the temple peak has been created. The lateral hub has been brought down. So this is how the whole zone looks like, very natural. And he keeps it beautiful because, of course, as in the modeling career, he needs to keep his hairline looking absolutely stunning. This is a young boy, again, comes from Goa, does a transplant in the hairline, just about 3,500 grafts in the top area. Good hair density and thickness over the donor zone. Hence, you could achieve a very good result with him with just single session of about 3,300 grafts that was planted. An old man at 63 also gets his hair transplant, but definitely who on the other pictures tell him that he's 65 anymore? He's definitely looking as young as a 45-year-old, and his wife is super happy with it. So talking of hairline and when hairline can go wrong, it is obviously done with the plugs or a too thicker graft with multiple grafts planted in the hairline for the first two rows, or maybe hairline which is softened in a way that actually didn't create a temple peak. So remember, the temple peaks creation is always important. Do not curve the whole hairline. That will give a very woman-like hairline. But of course, there are people who demand such hairline, and there are transplant doctors who transplanted such, which I've seen in the past. I have definitely brought those hairline back into the other zones, removed those grafts But of course, those are the people who typically kept their hair very long, and hence they were okay to have their temples filled as the reason they wanted to do it. But as you keep aging, with that age, they definitely don't look right. And so, of course, you use FUE techniques to bring out the same grafts by even finer punches, which is of zero point 0.7 and zero point 0.8 and allow those grafts to be planted back into the other zones. So, of course, too straight a hairline is not very good because that is becoming very obvious at times. Plugs are not good, which is like dolls punches which were done in the past. Of course, you need to soften them. Sometimes I've softened them with just even using micro pigmentation, which is for the scalp, that can be done as micro tattooing. We do it, and that can allow the softness of the hairline increased to a certain extent. Of course, some people do not like any color that is showing into the scalp, but of course we can go about a finger zone away and then hence give the density in the typical area of the top area. So bad transplant is typically where plugs are placed in the hairline. To forward the hairline is placed. Remember, when you do this, expression of the forehead is most important when you're deciding where the hairline should end. Never put your grafts into the frontalis muscle. Try to be as away from them. And if you can really just stay upward, you can say just there to the frontalis muscle and don't go in the muscle, you will not see the hair moving and dangling along with the movements of the forehead. Of course, female feminizing of the hairline is very important, where you actually curve down the hairline. Women typically who take buns or who have to really tie their hair very short or top like a bun, they have these fraction alopecia at the sides, and hence they lose the kind of density that they want. So, of course, you can soften the hairline by curving the hairline to a certain extent. That also depends on how your face is all about. So, you can see this is one of my results. Done, which was again, patient just didn't wanted to keep her hair. She was losing a lot of hair, so she just decided to go to Tirupati and get her whole head shaved, and that gave me a good opportunity to really extract a lot of good number of grafts. With about more than 2,700 grafts we planted just in the hairline, and that is how it looked. So this is the triangles that you can see. This is how we soften up the whole hairline, and this is now she keeps her hair long and soft, which is again a very good boon for her to keep her hairline the way she liked it always. Again, bringing the forehead shorter. Even from transgender, what do you call, men to women, they always want a hairline to be planted, which is definitely making them the face more softer and more feminizing. So that can be designed. You can see always, you typically design depending on the forehead shape. If the forehead is more flatter, you can actually go more softer. If the forehead is more curvilineous, you can actually go with a little bit of hump, and hence you can have those designs depending on what race, ethnicity, or the kind of density that the patient is desiring in the look. And remember, when you're going at the lateral side or the lateral hubs that you're filling, you do not have to really pile on the grafts with very high density. You can always keep the density as low as 20, 25 grafts per square centimeter, because remember, these hair are going to fall down eventually, and then they are going to be raised up to be held as a bun. They're not going to be actually pulled very straight away so that the scalp skin is showing. But even if that is a concern for most of the women, we have patients coming from all over the airlines and other people who really get their temple filled in with micro blades, and hence they look very natural, as those hair actually mimicking like hair, and there are strokes that are created with a blade, and that can really look naturally. But remember, of course, that is something which is to be repeated every couple of years maybe, but this is something which is a permanent, 10-15 years, nothing, the transplant hair is not going anywhere, and they stay with you for life. These are a few of my celebrity clients who've done it. Of course, typically everybody comes here for hairline design, and the hairline has to be as soft, as natural as they can. So in my experience over 18 years and over 2 lakh plus consultations and 5,500 plus hair transplant surgeries, I have barely seen new hair growth satisfactory enough to have changed the look of one. And of course, one needs to restore the hairline typically in most of the time, or temples also, in most of the time, by surgical means alone. Having tried medical management with cyclical therapy, low light therapy, minoxidil, serums, vice versa, use of invasive technologies like PRPs, mesotherapy, derma rollers, all have shown poor results, and of course, landing up in most of the patients to do at least their hairline. This is one of the results again who came in from Syria. Again, a patient got his hairline sorted, and of course, in his happy times, he sees hairline absolutely natural and fuller. Very happy to see that. Of course, colored hair is very challenging at times because the vision and the visual acuity is very different because of the light colored hair. And then sometimes you may probably want to use head eye. That's what I do, and typically make the hair look darker so that whatever the base is, that we can easily extract by the FUE. I also want to talk about the ethics in which we've talked about. We've talked about anatomy. We've talked about how the art should be. Of course, it is the hand of an artwork of a surgeon who is actually an artist in by nature. It understands the patient's face, personality, age, profession, or the sex which the patient is. And there are, of course, many requirements that the patient sometimes really discusses with you, asks for density and such. So, of course, there are ethnic or maybe there are ethics in which you have to follow the right way. And for age, you always have to convince the patient that you have to have a hairline which is middle aged and not very something which is just exactly age appropriate. Sometimes may not be possible. Leaving about centimeter, as I said, from the frontalis muscle, progressively increasing in over the temple area to have a look of a mature hairline. A profession in which typically patients have to have public appearances, teachers, politicians, celebrities, movie stars, of course, all have to have a better coverage and a very basic hairline design. And of course, there has to be a crown coverage, which they typically desire of doing with a transplant, but which is sometimes not possible because the graft count is low, or the quality of the grafts are not so good, or they already have certain amount of hair, but you don't want to destroy those by planting more grafts by using other hair from the body parts. So you would probably suggest them to surpass that age and time just by using a hair wig or a patch. This is also called as cosmetic skin in today's world, and really can give you a fantastic appearance in the top and the crown area. But of course, nothing as good as a hairline that can be just designed by a hair transplant. Of course, the sex of a patient is very important. Typically, depending on what age they come in, male, female, transgenders typically again have different requirements for hairline. Women typically come with the filling in of their middle partition, and of course, men want their temples or their hairline to be fixed in well. So, of course, every age will have its own requirements. And certain general requirements with patients typically ask us that do we want this hairline to be filled in such a way? I want it to be brought so close. I want it to be filled in this way. You can ask them to really design what they want, but give them what you have to. So remember, you have to be adamant and sure that you're using the graphs rightly. Of course, the density in which you're putting the graphs have to be well maintained. As I said to you, about first 2 to 3 lines, you have to give a density of about 25 to 30 graphs. As you keep going at the back part, which you create more of a sagittal incisions, you can easily do up to 35 to 55 graphs per square centimeter, which is decent. Of course, they can come back to fill in with more than about 70 plus graphs per square centimeter in the near future. That will again give them volume, but depending on what donor is available with you. So that donor density ratio has to be well calculated and measured. So temple density for female also, with you create the temple density because of the fall of the hair, as I said, you have to keep it as minimum as 25 to 30 grafts per square centimeter. Or you can take the quality grafts, which are a little thinner from the nape of the neck, which can allow the grafts to look more natural and thin. Of course, you do not want to oblige those patients by creating a temple peak as low, or rounding off the temple peak in the hairline, which is creating like a female pattern, or even making the face look more circular and feminine. So these are not necessary all the time. You can always outweigh what they're really looking at. Of course, if you're looking at converting a male hairline to a female hairline, or you're doing a gender correction surgery in which you already want the hairline also to be changed accordingly, you can create that with a softer appearance. Of course, widow's peak is also allowed, which can soften the appearance of a female hairline. And of course, correct the angulation whenever you see is wrong. I've seen patients with angulations in the temple going straight in, which is not right. You have to have the right correct angulation with the hair grow. So remember, when you do a slit, you create a hook and you lift it that way. Every time you put a skin in, of course, about 4 to 5 millimeters, you're creating the slit. You go in and you create a little hook, and that hook will hitch the hair in a way that the hair will come only at an angle. They will not come out straight enough. And of course, while planting, also you have to be very cautious. They do not plant straight, and you actually go with an angulation and push it in the angle pattern. This is what I prefer because I'm either a stick and place method person, or I'm a two forceps plantation person. I don't believe in implanters yet because I feel implanters get too overcrowding. Sometimes there is a lot of loss while there is being a push and pull all the time. So you can always judge your how you do it, how you like it. Of course, the word of caution here: do not exhaust the graft in the hairline alone, because I've seen most of the people who've done 5,000, 4,000 grafts just in the hairline, and they come out with lots of density of hair at the back, which is totally gone. And here, with that exhaustion and no donor left anymore, you don't know exactly where to fill in and how much. So those are the very poor patients who already had a hairline transplant in the youth, but now when they're in the middle age and they want their top filled in, remember, leave that donor safe enough for the patient to come back and do more transplant in the near future. So thank you so much for this beautiful talk, and I loved having Med Talks discuss this line with you. Of course, do not pull your hair like this, but of course, let them style the way you like it. Thank you.
Thank you so much, sir, for taking this important time and sharing your knowledge on this topic, sir. It was really great, comprehensive knowledge from your end, sir. I hope it will help all the participants on their practice, also PG students who have joined this session, to make it more informative. Sir, we have received some questions, sir. With all your permission, shall we take these questions one by one?
Absolutely. Go ahead.
The first question I can see is, sir, why must a surgeon avoid placing the hairline within the area of the forehead that wrinkles when the eyebrows are raised, sir? Can you please share some expertise on that?
Yeah, so again, as I said, when your muscle, frontalis muscle, is not just a muscle which is attached to the bone, to a certain extent, it is mostly attached to the skin also. So when you're doing any kind of facial expression, especially the frontalis muscle is moved, the follicle which is planted will also have its own music. It will play along with it. So you do not want somebody to raise their eyebrows and they see their hair shaking. So this is a very common problem that can happen if you actually bring your hairline so down. You typically can enter into the muscles, and the muscle will accommodate the hair, no doubt. But at the same time, that accommodated hair with the bulb will be moving along with the muscle strength. So you can always raise if you really have to make a hairline going more down, and you want to create that filling part. You probably raise the skin almost up to 3 to 4 millimeters by putting a Timosin fluid, and then you just let the graft settle into only the subdued zone. So you can actually lift the skin and you can create a hook like a zone so that the angulation is right. Plus, the hooking will allow you to only be in the subdued zone, not go into the muscles. So that could be one of the ways to avoid it. But of course, best is do not go into that zone. As I told you in my hairline, my first thing is you raise the eyebrows and go 1 centimeter above it. So there is never a problem of anybody getting into the frontalis muscle.
Thank you so much, sir, for sharing your expertise on that question, sir. We have another question, sir. Which anatomical landmark is could be standard starting point for measuring the height of a new frontal hairline, sir? Can you please share some point on that?
So the height in which you can always, Sarah said, you always have the rule of three. Then secondly, you can always take the muscle strength so that the height can be increased, or you can actually go back to the old pictures and assess how broad their forehead has always been. So you do not want to make them look very different from their actual old pictures were. So of course, sometimes patients are very excited to have a new hairline altogether, and they look very different from what they were before. But you may sometimes fall in trouble because those hairline sometimes suits very well, but sometimes could be really a disaster that the patient wants to change it later, which you cannot want. So that is the time when you decide to make the forehead little back. Always there is a chance that you can come back after 6 months, 1 year, to reduce the forehead hairline by putting in some more single grafts, maybe about 1200 odd grafts, just singly put very subtly over the frontal area so that they can still have a more youthful appearing hairline. But if you don't want to do that, you just stick to the standards, which is, of course, rule of three, or go at least a centimeter above the frontalis muscle. So, and of course, make the patient do all the animation possible so that you can understand that your hairline, wherever it is not coming under the animation zones.
Yes, sir. Thank you so much, sir, for again for sharing your expertise to that question. We will take one last question, sir. What is the most important factor to consider when a young patient requests a low juvenile hairline, sir?
Yeah, so I just showed you a few pictures of a 19-year-old, 24-year-old young boys. I do give in to them because I see that they come with a lot of psychological impact. They come with a lot of family, stressed out family because of their lifestyle that they want to live, and they're not able to because of their hairline has gone way behind. So you may sometimes oblige to give them a softer looking hairline, more natural, and bring them little down. But remember, you will always have to push it back. So with that intent, keeping them in the same page, you tell them that I will do it for now, but when you come back after 15 years, 12 years, I will want to push it a little back, and I will actually extract them back and put them. So of course, the finer punches today's time do not allow us to make larger scars in the front. Otherwise, that is the most scariest part, that would be have scars when we remove those grafts and put them in the back when not needed. But today's times, because of the finer punches and because of the healing of the skin, because of the certain healing agents that we have available as applications, as sprayers, as healing factors that can really make the skin heal faster and do not leave much scars. You can still do that, pushing in of the grafts to the certain zone. But remember, when these young patients come, your first goal should be is convincing them rightly. I have always taken a lot of time to convince them that, look, your hairline at least will recede by or come back by 1 centimeter if you take the cyclical nutritive therapy, if you take some PRP injections, if you take some procedures. I know this personally that it's not going to happen, but this is to bring their extempo or their personal wishes to certain level and a hold, that they gain some maturity over it. And buying that 6 months, 1 year time will really make them realize that what they were about to do then is not right, and hence they would probably now be a settled person with a hairline of a middle age that they'll be able to accept. But when this young person comes in demands for a hairline which is as low, wants to look very different and new, I would sometimes, given as I said to you, we do it and tell them that you do a four-finger zone, which is a good density of the hairline with up to 4,000 grafts also. And from here onward till the crown, this is the area which is gone. And if they're grade 4 and 5, you would want to give them a better advice. You cannot just tell them, look, I will fill up the whole head with maybe 8,000, 15,000, 20,000 grafts. That doesn't really happen. You can, what you can is from the donor about 4 to 5,000 grafts, from the beard maybe about 2,000 grafts, from the chest maybe about 3 to 4,000 grafts. But that is still allowing you to maximum reach about 8 to 10,000 grafts, maybe about 12,000 grafts, and that too in different phases in different times in time to come, in about 6 8 months time, when you have to keep on calling the patient again to fill up more. Or some people, of course, with the large number of team that they have, they can do scalp hair 4,500 5,000 grafts, and beard hair up to 3,000, maybe 7 8,000 grafts in a day, which we typically also do. That's it. And then let the hair grow, let the hair flourish, let the hair take its own shape and time. But remember, if patients like youthful who would like to keep their hair very short, they don't want to keep just like a stubble like a look, they will never have the density as good as what one has. Because remember, you are born with this number of grafts, and what you lose is 50 to 60% of your hair graft quality and quantity, and you cannot gain back that same 50%. If I'm saying that you have a lack full of hair and you lose 50,000 hair, you can gain back 50,000 hair by transplant. Is that what you're saying? Doesn't happen. A transplant surgeon can give you maximum of 20 to 25,000 hair, up to 12,000 grafts, if you're looking at as a number, which is in a couple of sessions to come. And that is going to fairly cover your zone. It's not a way to gain back hair of the density that you were born with. It is the way of hair that will grow to camouflage your scalp in a way that you'll have coverage, you'll have fullness, because the hair grows and falls over each other. And hence, with only 33% of the hair growing on your scalp, you still have a head full of hair. That's what the purpose is. Remember, a head full of hair doesn't mean that every microcentimeter, millimeter will have 3 to 4 hair. That's what God gave you. But when a transplant surgeon gives you, he leaves a gap of about at least zero point 0.8 millimeter between two hair to allow the graft to grow first. And once he's done that thing, he can go in between that and put one more graft, but of course in the next session to come. So remember, understand your surgeon's how he tells you what is right for you. Understand how he comes from and where he comes from, what he's giving you as advice, and go slow. Go with the pace of the doctor, because he is the one who's going to carry you throughout as your whole journey of hair loss and hair thinning is, and hence give you that density, that look, that cover, and you're going to be there with him. So that's where the hand holding of the surgeon is most important. And if that can happen, you are in the right place, you are at the right doctor's hands. And hence,
Yes, sir.
you can call that surgeon the one who's really been blessed with the whole idea. That's why hairline design is one of the most precious, most important thing that one can really take a call on and go to the right person. Again, I'm repeating the same thing.
Yeah, so thank you so much for sir answering this question and giving a very good message to all the listeners, sir. I hope it really works. Like people do try to make the things by their own by searching in the internet, sir, and it's better to consult a expert who is having a expertise on this particular thing, right, sir? With this, sir, we are closing for today, sir. We would like to see you in future also with different topic. It was a very good presentation from your end, sir, and great honor to host you, sir. Thank you so much for valuable time, sir. Take care, sir.
Thank you so much.
Welcome, sir.
Thank you for us. Thank you, Med Talks. Pleasure to